Well, thanks, Shaka. The Harvard Global Health Institute and the London School of Hygiene and Tropical Medicine say that the slow response to the Ebola epidemic cost thousands of lives. The report also says that the biggest single failure was that the World Health Organization's delay in sounding the alarm on the outbreak. Well, this leads us to our question of the week, asking, what kind of reforms do you think the global health system needs to help African governments recover from the Ebola epidemic? Well, thanks everyone for using all our social media platform to communicate to us. And another reminder that we are tweeting live today. Just use the hashtag VOA Ebola Free or hashtag Ebola Free. And speaking of it, let's go to a tweet from Rodney Tuhami of Makerere University in Kampala, who proposes the solution to elaborate healthcare systems and create a center for disease control. Another tweet, this time from Gama Thabani of South Africa, says, connection of the traditional medicine and sciences and also faith will heal the world of all sicknesses. That's very interesting. Let's now move on to a Facebook comment from Pius Kwegondeza, who is originally from Uganda but currently lives in Edgartown, that's in Massachusetts. He says, communities should always remain alert, not just for terrorism and politics, but also concerns that impact our health. Well, Shaka and guests, your take on these comments.
Interesting, your reaction, Dr. Jha.
So I think there were several very important comments there about certainly the role of communities. Communities, local health systems are always the first line of defense. And so I found several of those comments, I think, to be very helpful. And I agree with the notion that we need a global health system. You know, we are supposed to have one. That was the purpose behind the WHO. It is the purpose behind the entire UN framework. That health system did not work as it was supposed to. And so I think we need a very careful examination, both of what went wrong. There were some things that actually went right, and understanding what went wrong, what went right, and then ultimately putting in plans to make it better.